vertigo is that true spinning. It's like you're spinning or everything around you is spinning. Weakness, obviously, that's not a good sign. That can be bothersome. The fatigue, even though we classify it as extreme fatigue, that one can be the most confusing because it's really hard to effectively quantify that. I mean, is anybody tired after a day of diving? Okay, I know I am too, absolutely. And that we expect that. Those of you that have a good experience base, you'll find that the fatigue we are concerned about is out of proportion for what you would normally expect for the amount of diving or the type of diving you've done. You know, if you do 4 dives, you're going to be more tired than if you just did 2. Now, for divers that may not have as broad an experience base, it's the type of fatigue that is almost incapacitating. You have a hard time doing things that you would normally do without difficulty. You have to really struggle to get your wetsuit off, you're having trouble carrying your gear bag, those kind of things. Another factor with this type of fatigue is that it doesn't get better with rest. Now the headache and nausea, those things by themselves, it's not unusual for people to have a headache after a dive. It's not unusual. A headache alone, usually not much to worry about, but start looking to see if there's other things going on. Take note. The same thing with the nausea. A lot of times that can tie into that vertigo. But again, by itself, maybe nothing, but be suspicious. Look for other things. The itching and rash, it's not going to look like a traditional, like poison ivy rash. It's going to take on a very mottled or marbled appearance. Sometimes it'll even look like bruising. And it tends to show up where we all tend to accumulate the most fatty tissue. No matter how good a condition you're in, we all have a layer of fat under the skin. So more often than not, it's going to appear, now it's not limited to, but more often than not, it's going to appear across the abdomen, the buttocks, thighs. Women will even surface from a dive complaining that they have breast pain, one or both. Now the more serious and gratefully less often seen symptoms are these. Now anytime somebody surfaces from a dive and is unconscious at the surface or shortly after becomes unconscious, not a good sign. Not a good sign. That says something bad is happening. The same thing if they're paralyzed. And usually that paralysis is typically from the waist down. Also, convulsions or seizures, that's never good too. That's never a good thing. And these are the folks you really worry about and know they need to get somewhere in a big hurry. Some people, it's a matter of having difficulty walking, indicating it may be weakness in the lower legs. That can be kind of hard to detect, especially if you're on a rocking and rolling dive boat, because we all look drunk when we're trying to stumble across the deck of a moving boat. But if they had no trouble on the way out and suddenly they're now having trouble on the way back in, be a little suspicious. Personality change, it doesn't necessarily mean that it's actually affecting their brain. It can be as simple as somebody knows they're not feeling well, but they're not quite ready to admit it. They'll be sitting down, you'll see them kind of fussing with a shoulder or something, and you walk to them and, hey, John, how you feeling? And John looks at me uncharacteristically and says, I'm fine, I'll be fine, leave me alone, okay? That's not John. And it could be just the fact that he's scared. He knows something's wrong, but he's afraid. So that too can be that kind of a subtle personality change. Keep that in mind too. Bowel or bladder problems usually goes along with paralysis, usually pretty obvious. And remember that any symptoms that are different than what somebody would normally have, anything that's different, if somebody says, you know, I never get a headache after a dive, but this time I've got a headache, be suspicious. Be suspicious and look for other things as well. The factors that figure in most heavily, and we know are risk factors, are our depth, the amount of time we spend at a given depth, and how quickly we come up. And again, the altitude exposure too soon after diving. We know flying after diving, and remember that commercial aircraft, the passenger cabin that we're in, is pressurized usually between 2,000 and 8,000 feet in altitude. So even if you're at 30,000 feet, that cabin is still only pressurized to 2,000 or 8,000. Average is around 5. And that's enough. If you've got too much of a nitrogen load, that's enough that it may produce symptoms. And people seem to forget that driving over a 3,000-foot mountain after you've been diving is pretty much the same as getting on an airplane. But it's amazing how many people forget that that's as much of an altitude exposure as flying. But they forget to think in the same terms. These are possible contributing factors. There's still no scientific evidence to prove or refute these, but we know that they can play a role in it. Of course, we want all of us to be in good general fitness, one that helps keep our heart healthy. We know that doing multiple dives over multiple days, like a dive resort or certainly the liveaboards, you accumulate more nitrogen over time. And you have to be careful of that. Unfortunately, body fat and obesity. Obesity more because of the complications it brings. Obesity itself can lead to high blood pressure, heart disease, diabetes, a lot of very serious health complications. Current illness or injury, more often than not, this is why we tell people don't dive with a cold. As simple as their ears stuffed up and they can't equalize. Well, that's a good way to ruin your dive vacation. Your ear hurts, you can't equalize. It's not life-threatening, but you're still done diving for the week. So avoid that as much as possible. Alcohol, drugs, anything that can impair your ability to function and think and certainly respond in the case of an emergency. Be mindful of that. Also, we know that alcohol contributes to dehydration. We also need to put in there drinks that have a lot of caffeine in them. Even sodas that have a lot of caffeine can increase urine output, which leads to further dehydration. We do know that strenuous exercise after diving can increase bubble formation. Now, there's still no direct cause and effect between that increased bubble formation and decompression illness, but if we can keep the bubble count down, then it stands to reason we could reduce the likelihood of decompression sickness. Age, well, that all comes down to general fitness. A study that was done by Dan on the aging diver, they found that if folks remained in good cardiovascular and respiratory condition, they can continue to dive. There's no particular age that says you have to stop diving now. Of course, as we get older, they recommend that we be a little more conservative with the diving, just on general safety principles. Not as long, not as deep, that kind of thing. Water temperature can certainly play a factor. Colder water can contribute to problems and to losing body heat in general, affects your well-being. Also, colder water increases urine output too. So that's another thing to remember. So if we suspect somebody, what do we do? First of all, we're hoping everybody recognizes the symptoms to look for. I am a huge fan of the Dan neurological assessment, the on-site. That course, I like it so much because it's designed specifically for divers. What's important to know neurologically about a diver? And it teaches you, it gives you a very organized, methodic way of checking things. And it also is designed to seek out the more subtle signs that you might otherwise overlook. So I highly recommend the course to every diver and even non-diving significant others. Because if the person gets home from the dive and they're suddenly not acting right, their spouse knows what to look for. Make sense? Okay. If you've got a diver, you want to make sure that their airway is clear, they're breathing, and then unfortunately, if necessary, do CPR as appropriate. If they're conscious, breathing on their own, you give them 100% oxygen and get them to the nearest medical facility. Preferably have them transported by the local emergency medical services. They have an almost unlimited supply of oxygen, as does the local hospital. Keep in mind, too, that not everything that looks like a dive injury actually is a dive injury. If they surface from a dive and they've got pain in their left shoulder, is it DCS or are they having a heart attack? So keep that in mind. Sometimes it's worth going through that process of elimination to make sure of what you're dealing with. Not that you're going to harm them, but you could be wasting time by treating the wrong thing. Keep in mind, too, that lung overexpansion injuries, sinus and middle ear barotrauma, none of those things are treated in the hyperbaric chamber. And absolutely call Dan, and we can help coordinate who's got the closest and appropriate facility and chamber available at the time.